Welcome to The Last Breakfast. Please enjoy the video.
In this video, I will explain how to use calcium tablets. Take calcium with meals to improve absorption and reduce stomach upset. Start by checking your diet for dairy, leafy greens, and fortified foods to estimate intake. Talk to your healthcare provider before starting supplements if you have kidney disease or take other medications. Keep doses under 500-600 mg per serving for best absorption and avoid taking calcium with iron or zinc supplements together. When using calcium tablets, timing matters for absorption and tolerance. Split larger totals into 500-600 mg doses spaced across the day instead of one large pill. Choose calcium carbonate with meals for better absorption or calcium citrate if you have low stomach acid or take acid reducers. Avoid taking calcium at the same time as iron or high-dose zinc supplements. Track your total daily intake from food and pills to stay within safe limits. Calcium tablets are generally safe when used correctly, but be aware of side effects and interactions. Mild bloating or constipation often occurs and can improve by lowering dose or spacing tablets. Excessive calcium can increase kidney stone risk, especially if you already have a history of stones. Talk with your healthcare provider if you take medications like blood thinners or thyroid drugs, and have blood tests checked periodically to monitor levels and kidney function.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.